Welcome to the second episode of Prescription for Primary Care. I'm Tanya Dodaro, your host for today's roundtable discussion. I would like to introduce our panel from Healtheon CEO, Dr. Raymond Rupert, Chief Revenue Officer Ted Berlad, and Ryan Tso. Welcome to today's roundtable. So today we're diving into a groundbreaking initiative led by OurCare. OurCare spearheads the largest pan-Canadian dialogue on the future of primary care. So they set out to survey 10,000 Canadians to gain a deeper understanding into the sentiments surrounding our healthcare system. So while there is a strong belief that our healthcare is doing a good job, there's also many people who feel like timely care is missing, high quality care is missing. I'm curious to start the conversation. As Canadians first, how do these findings resonate with you?
It's very true. I have trouble reaching my family doctor. There's no phone number. There's no email. And it just doesn't work. And then when I get to see him, it's one problem, one visit. What if I have 3 problems? And then he's very rushed because he's got 10 people in the waiting room waiting who somehow managed to get in there. So, there's an issue with timeliness, the quality of the interaction, it's very transactional, etc. All of this needs fixing, and that's why Healtheon exists.
Ryan, do you share the same sentiments when visiting your primary care doctor?
Yes, I think I have a very, old school family doctor. So absolutely no technology, no EMR. When I requested for some personal patient information to then share to a specialist, he had to scan all 20 documents, handwritten documents, and then print them out for myself, and I had to go into the other specialist office and hand them in personally, rather than him kind of maybe using the EMR system to share it using an e-fax or something like that.
Well, I concur with Raymond and Ryan with issues. There's so many, Tanya. Everything about the way they run their practices is not efficient. So I went to my family doc a few weeks back. I had an issue with my hearing in one ear. And sure enough, he looked in one ear, looked in the other ear, and said, okay, I could send you to an ENT, but it's going to be 6 months. 6 months waiting. So the system is completely broken.
None of this is making sense. Doctors are here to help. Patients need help. Where is the break in the communication?
The economics of primary care don't work. Doctors are not paid enough. They don't have money to hire a nurse or a staff. It's dollars and cents. And patients really have to partner with their doctors. That's the only way there's a solution. And that's why we brought Healtheon into being, is to allow patients to participate, for them to partner with their doctors and build a sustainable economic basis for primary care.
If what you're saying is true and money is the issue, or is part of the issue, the federal government just pledged $46.2 billion for healthcare over the next decade. But doctors argue that much more is needed to make meaningful changes. What's the strategy behind this? And do you believe by simply injecting more funds, our problems will be solved when it comes to primary care?
Yeah, so first of all, it's a $300 billion industry. So 46 is, not 300. So the healthcare system represents what's called a complex or wicked problem. You've got systems and silos, you've got different jurisdictions, different rules, etc. So it's a complex, almost wicked problem. And wicked problems cannot be solved by adding dollars and cents. There has to be a holistic restructuring of the entire system. There has to be the addition of AI-enabled technology, which is what Healtheon is doing. There has to be the funding of team-based care, which is what Healtheon's doing. And there has to be an enhanced patient experience, which is what Healtheon is doing. So don't give me dollars, give me a real solution.
Just to add to Ryan and Raymond, and they're both dead on right. I went to my orthodontist a few weeks ago for my son, and it runs like a machine, whereby you have about 10 chairs, and then you have your hygienist or assistants working on 10 patients The orthodontist is just walking around, and I won't say just walking around, but walking around efficiently, seeing each one of these patients at separate times and just giving the final touches to it, right? It's so much more efficiently run, and that's, I think, where Healtheon comes in. We're trying to educate the public, and we're trying to help the physicians to build their practice in a similar fashion that's way more efficient than it currently is.
With team-based care.
Correct.
That makes a lot of sense, and I too have kids who see orthodontists, and it seems like a very well-oiled machine. So they've got it right. Why are MDs so slow to adapt to that same system? I mean, it's right in front of them.
They don't have the funding for team-based care. And if they had team-based care, then the patients would have a better experience. And the doctors would be able to take care of many more patients.
Because team-based care answers all these issues, right? How can they refer specialists when A, they don't have time to research it because they're so busy dealing with 17 things at the same time, and they have to deal with all this paperwork, and now you're walking in, or I'm walking in, and I need an ENT. They're like, okay, let me go on the computer. Okay, boom, it says 6 months. There's not much I can do with it. I don't have someone that can help you with this other than to tell you that you'll get in there in 6 months. If you don't like it, there's not much I can do. I really have to move on to my paperwork now, right?
Healtheon is going to be bringing experts into the family doctor's office through several plans, and the patients can opt in for these plans, which gives them almost immediate access to over 4,000 specialists. So I think the family doctor is going to be pleased, and I think that the patients are going to be pleased by having timely access to specialists.
No, it's really true. The fact that Healtheon can bring these specialists or team-based care into these practices, it's such a win-win for everybody.
So just switching gears a little bit and just to deepen our discussion on and around the survey findings, I've noted that a number of medical residency spots has remained stagnant for the past decade, which is quite alarming. What steps can be taken to attract more family doctors?
It's really the fact that family practitioners are burning out. It is not groovy to be a family doctor right now. On the other hand, if Healtheon arrives with AI-enabled technology and team-based care, family practice becomes very groovy. And you'll find that there'll be a tendency for young doctors to enroll.
Ryan, I'd love to hear your thoughts. You're very close to this because I know you've done a degree in the healthcare space. What did you see and hear on the ground?
So I think just to add a little bit more about, to Raymond's point, I think it's definitely about changing the perception of primary care. I think definitely working with my fellow classmates who are also kind of looking into going to med school, I think they were definitely looking at other specialties based on kind of the income potential. And the work-life balance potential, and I honestly, I don't think primary care, the primary care space was really in their view, just because the perception of when you talk to a previous primary care doctor like Raymond, a lot of them might deter them from even going into that field because the work-life balance, the income potential, the support isn't really there.
With all the questions and discussions we've had, the answer is Healtheon. We've been tackling our healthcare issues for years. We've had some of the brightest minds trying to tackle this issue. I'm going to ask a tough question. Why now? Why is Healtheon the solution?
Well, that's a really good question. So healthcare is so broken that it's actually at a tipping point, Tanya. When an industry comes to a tipping point, then solutions have to emerge. And the interesting thing is that Healtheon has a solution that we can apply in any family practice in Canada. There's only 45,000 of those doctors, and help thousands of patients and doctors to get timely care. So Healtheon is the secret sauce.
I think Tanya, Raymond's dead on with that once again. I've been in this industry for 20 years, and physicians have been complaining for 20 years about the broken system. I think where the tipping point has come is now the public is also complaining, and I think both sides are at the end. Both sides are so sour, and that's what's created this, because if it was just the physicians, the public goes along their merry way and no one will do anything about it. But now both sides are at the tipping point, and that's why they need the services that we provide.
When it comes to Healtheon solutions, is it something that has it been created just because of the need in the Canadian system, or is this something where we can look at taking it global and scaling it to other healthcare systems?
So the Healtheon solution can be utilized just about anywhere. So, I mean, that would be terrific to have a made in Canada solution that could be utilized in other countries. Absolutely. Because we've got an advanced society with lots of very smart people, lots of diversity. It's a great country, except they've got to change healthcare. And that's what Healtheon's attempting to do.
Thank you for all your time today, and that wraps up episode 2 of Prescription for Primary Care.